Hello and welcome to the first video of this three-part video series on trauma and regulation. My name is Brianna McInerney. I am an occupational therapy doctoral student and I'm very excited to present these videos to you. My goal while making this video series is to explain some of the impacts of trauma on foster youth and then look at a few different strategies we can use to help them recover and live their lives to the fullest. In this first video, I'll provide an overview of trauma and trauma-related topics. In the second video, we'll examine the sensory system and sensory regulation. In the final video, we'll look at the specific self-regulation and behavioral management techniques and strategies for foster youth. Well, let's get started. So this first video will cover the origins and impact of trauma faced by foster youth, examine the mental health disorders commonly diagnosed in foster youth, and explore trauma-centered care. So, what is trauma? Well, there are many different definitions of the word trauma. From a psychological standpoint, trauma is any event or series of events that causes severe distress for an individual. These events can be singular significant events, such as war, natural disaster, an assault, or the threat of or death to a family member. These traumatic events can also be chronic, such as bullying, domestic violence, neglect, and abuse. Chronic trauma, which is also referred to as complex trauma, is the most common form of trauma experienced by foster youth, as it often begins in early childhood. However, it is important to remember that every single foster youth, 100%, have experienced some form of trauma before entering or while in foster care. The most common forms of trauma experienced by foster youth are neglect, homelessness, physical or sexual abuse, emotional psychological abuse, or just the general form of rehoming or the loss of prized privileges, desired connections with family members, or anything similar to that. But what does trauma do? Why is it important that we know about trauma? Why is it important that we study it? Well, to understand this, we need to go back to the beginning. Well, maybe not quite that far back. Back to the beginning of brain development, anyhow. At birth, the human brain has billions of brain cells. These are called neurons. They're just waiting to make connections with each other. As an infant grows and experiences the world, some neurons connect with each other and grow stronger, and others die off. This is a process called neural pruning, and it works similar to how when you trim a plant, you keep it healthy and you make it stronger. The more a certain pathway is used, the stronger it will become, kind of like a muscle when you work out at the gym. At around age 3, the creation of new connections slows down dramatically, and your brain begins to use or ignore pathways that have already been created. When we reach our teenage years, our brains begin another round of pruning with very little new growth occurring. This later pruning strengthens and leads to the maturation of the brain. If you look at this little graphic here, you see that at birth there's very few connections that are formed. By age 6, we have quite a few more connections. They're just connecting everywhere. And then by 14, there's many fewer connections, but the ones that remain are a lot stronger. Most of this later pruning and strengthening occurs in the prefrontal cortex of the brain. The prefrontal cortex is responsible for all of our higher functions, such as critical thinking, emotional control, self-control, memory, problem solving, and more. These functions are all referred to as the executive functions of the brain. Now that we understand a little bit more about how connections to the brain develop, how are these impacted by trauma? How does trauma change these connections between neurons? Well, let's go back to our gym analogy that we explored earlier. Pretend that our neuron pathways are muscles in the body. The muscles we use more often become stronger and bigger. Of course, this means that the opposite is also true. The muscles that are used less often become smaller and weaker. Let's say you went to the gym every day and did nothing but bicep curls. Sure, in a few months you might have biceps the size of bowling balls, but would your legs be stronger? Would your back? Would your triceps or your wrists? In some instances, these muscles that you don't use can even die if they're unused for long enough. Much like these unused muscles in your body, the neurons and the pathways, when they're not used, will become smaller and weaker, and they may even die. These changes can begin all the way back in infancy. When an infant cries and the parent or caregiver responds, it strengthens the connections in their brain that allow them to feel safe and loved. As parents and caregivers continue to respond positively to the child's needs, these connections are strengthened. Unfortunately, the opposite is also true. If a caregiver or parent doesn't respond for whatever reason, it prevents the infant from forming an emotional connection to them. The connection that otherwise would lead to safe, secure feelings, secure attachments, these just don't form. And these pathways in the brain die, and so do those neurons. There have been multiple studies that have done MRIs of the brains of people who've had neglect and those who haven't. They found significant differences. If we look at this MRI here, on the left is a normally developing 3-year-old child. And on the right is an MRI of a child who suffered severe neglect. As you can see, not only did it change some of the structure of the brain, but it also changed the size. Much like the muscle that's never used, if the brain's not stressed and given new experiences, it just doesn't grow. Unfortunately, through these MRIs, they have found one part of the brain that does grow at a larger rate than those of normally developing brains. And that's in the brain's fight, flight, and freeze reaction. For most people, when we experience a stressful event, maybe something runs out in front of our car when we're driving, or we're walking through a haunted maze and something jumps out at us, or we drop something and we think it's going to break. It causes a stress response. In our stress response, our heart rate goes up, our breathing will increase, the blood rushes to our hands and our heads and our legs. We're ready, we're alert, we're waiting to see what we need to do. This is called the fight, flight, or freeze response. Normally, for us, once the danger passes, the stress response goes down and we go about our days if nothing had happened. What happens during chronic stress and trauma and the changes in the brain is that the stress response doesn't go away after the event. When the danger passes, the person remains on edge. They're still ready for something to happen. They're still alert. In other words, the connection between the stress response and the rest of the brain are really strong, while the connections to the part of the brain saying, it's okay, everything's all right, is weaker. And many of these weaker connections occur between the limbic system, or the emotional system of the brain, and the prefrontal cortex, the higher functions, the command center, the part of the brain that lets us think things through and can tell us everything's all right, you're not in any danger right now. So let's think back to some of the youth in our care. If 100% of foster youth have experienced trauma, then it means that so many of them are always on edge. They're always in this fight, flight, or freeze reaction. They're always expecting something to happen. And this chronic activation of their stress center and all this exposure to previous trauma can mean that many of these youth are also much more susceptible to mental health disorders. One study found that current and former foster youth experience mental health disorders at a rate of 2 to 2.5 times more often than the rest of the population. A lot of these common diagnoses that you see in foster youth are post-traumatic stress disorder, or PTSD, depression, anxiety, ADHD, or attention deficit hyperactivity disorder, eating disorders like bulimia, anorexia, or binge eating, oppositional defiant disorder, or even conduct disorders. These diagnoses, along with the chronic activation of a stress response, can impact the foster youth's ability to concentrate and participate in school, find and keep employment later in life, form meaningful relationship with their peers or their caregivers, and even participate in activities they enjoy. So what can we do to help? Well, this is where trauma-informed care comes into play. Trauma-informed care, or TIC, is a holistic approach created by mental health professionals who worked with a large population of previously traumatized individuals. A TIC approach focuses on being aware of past trauma, addressing trauma in a supportive manner, and avoiding re-traumatizing an individual. So let's look at a few examples to see how seemingly innocent actions can actually be re-traumatizing to the youth in our care. Let's say you have a 10-year-old girl in your care, and when you gently touch her arm or shoulder to get her attention, she lashes out unexpectedly and screams, "Don't touch me." What you may not have been aware of is this young girl was sexually abused or physically abused at the hands of a family member, and by gently touching her shoulder or her arm, you accidentally cause her to re-experience a moment similar to her past trauma. And let's say you have a 15-year-old boy in your home who screams and throws things when you threaten to take away his video games if he doesn't do his homework. To this boy, the potential of losing his video games, something that he really enjoys, takes him back to when he perhaps lost privileges before by a caregiver. Perhaps it reminds him of a previous placement change where he had to leave behind some of his prized possessions. And finally, let's look at an example that is probably pretty common to most people. Let's say you have a 4-year-old boy in your care who throws a tantrum or becomes very upset when you tell him he can't have a snack right now because you'll be eating dinner in 30 minutes and you don't want him to ruin his appetite. Most likely he doesn't understand that food is always going to be available in your home, or that in 30 minutes that he can have everything he wants to eat. All he knows is that previously he didn't have enough food, so he has a great sense of food insecurity now. While these scenarios are sad and potentially frightening, they're also great examples of how re-traumatization can accidentally occur during a typical daily event, such as touching someone's arm, or asking them to do their homework, or wait for supper. These scenarios also underlie an important point of trauma-informed care. There's always a reason behind a behavior. Once you understand what the reason is, or what their trauma is, you can address it, which eventually will help to reduce these behaviors. But you may be thinking, okay, how do I do that? Where do I even start? Well, the perfect place to start is through TBRI. Now, you may have heard of TBRI before, but just in case, I'll give you a little overview. So, what is TBRI? TBRI stands for Trust-Based Relational Intervention, and it was created by Karen Purvis and David Cross in 2007. It was created as a way to address trauma through the combined efforts of caregivers and professional services, and it follows the 3 pillars of treating complex trauma: developing a sense of safety, promoting healing relationships, and teaching self-management and coping skills. From these 3 pillars, Dr. Purvis and Cross created the 3 guiding principles of TBRI: the empowering principle, the connecting principle, and the correcting principle. So looking at this, you may be wondering, okay, how do we begin? How does this begin? How does it work? One of my favorite quotes from Dr. Karen Purvis is this: "If I have a function and I lose it, I regain it the same way I lost it." So, with this in mind, if we use TBRI to treat youth who've experienced trauma, we need to go back to the very beginning and see where the function was first lost and where the trauma first occurred. To do that, we go back to that early cycle of brain development in the infant, where the parent responds to the infant's needs, creating a feeling of safety and security. This is where TBRI begins, too, with its first principle, empowering. The empowering principle strives to create a sense of safety in older youth the same way a parent with a new infant might, by meeting their basic physical, sensory, and environmental and psychological needs. Meeting these needs creates a sense of security and helps reduce the fight, flight, and freeze response. If a resource is always available, the cycle of anxiety never begins, and the body is able to recognize that there's no reason to be on edge. TBRI begins with the empowering principle to not only create safety, but also ensure there are no sensory or environmental factors that are limiting success. A topic that will be covered more in depth in video 2, when we look at sensory regulation. Once youth have started to develop a sense of safety, the next principle, the connecting principle, comes into play. Some examples of the connecting principle are making eye contact with youth, paying attention to their nonverbal cues by looking at their body language, their facial expressions, and also paying attention to your own nonverbal cues, looking at your own body language and facial expressions. In this way, you can respond to the nonverbal cues that a youth may be portraying, and then allow them to feel heard by responding to that emotion. During this part of the connecting principle, you can also start teaching emotional language. You can start using words for what you notice a youth doing with their body or how they're acting. That way they can begin to relate their own reactions to how they're feeling and to their emotions. So, great, you may be thinking. The youth feels safer, we're all emotionally connected, but we're still having tantrums and throwing things around the room when we're not getting a snack or having to put away our video games. Well, that's where the third principle of TBRI comes in, the correcting principle. This final principle focuses on teaching self-management and self-coping skills. This principle, foster parents are encouraged to use scripted dialogue, role-playing, really increase and focus in on that emotional-based language to foster better self-management and self-regulation when it comes to behaviors and emotional outbursts. This principle also teaches youth how to use coping skills such as deep breathing, pressure techniques, and other self-calming skills to encourage greater self-regulation. The correcting principle also teaches responsive behavioral strategies for instances when a youth is not able to regulate their own behaviors. In this instance, for TBRI, we use the ideal approach. This approach details a list of actions specific to a youth's behavior. These actions should always be immediate, direct, efficient, action-based, and your response should always be leveled at the behavior and not at the child. See? The ideal approach. The process of using the ideal approach and other self-regulation strategies will be covered more in the third video of this training series. For more information on TBRI and trauma-informed care, you can watch some of the videos on YouTube put out by Karen Purvis on TBRI. You can read Karen Purvis's 2 books, The Connected Child and The Connected Parent, which detail TBRI and other trauma-informed responses. You can also ask your social worker or training coordinator for trauma and TBRI training through the Family RTC. Well, that's the end of our first video. Stay tuned for our next videos, which will examine sensory strategies and sensory regulation and self-regulation and emotional regulation strategies. Thank you so much for tuning in.